Your Excellency, that was quite inspiring, what you shared. As you said, we cannot be here again, and I just want to say, on behalf of our government, that we thank you for trusting us to reset and appreciate your openness to how we move forward. I think you'll be encouraged, in fact, by the next panel, which I now have the pleasure of introducing. I would like to honor the Honorable Minister of Sierra Leone, Dr. Austin Dinby. He's their Minister of Health and Sanitation. And the role that he is in now, while it is a very important one, follows a career in our U.S. government. And so I know that Minister Dinby holds a special place in our hearts here in Washington. Thank you for your work and for your service, both in the Republic of Sierra Leone and also with the CDC and PEPFAR. With that, I turn things over to you.
Thank you very much, Assistant Secretary Pace. This is a really pleasing moment for me to come back to Washington, D.C. To meet with family, extended family in HHS. I'd like to introduce the panel for today, starting with the Honorable Junga Dungu, the Cabinet Secretary, National Treasury and Economic Planning of Kenya. I believe he's on his way, but we'll save a space for him. I'll also like to introduce Dr. John Nkengasong, the U.S. Global AIDS Coordinator and Special Representative for Health Diplomacy. John? I'll also like to introduce Chidima Mpefe, who is the Director for the African Medical Supplies Platform. Chidima? Well, thank you very much. I think with the incredible lead from His Excellencies, the two presidents, we want to follow up with some of our thoughts around partnering for sustainable health cooperation in the health sector. So I'll start by just my small experience in Sierra Leone. We have a situation in Sierra Leone where in 2014 to 2016, we had the Ebola outbreak. We lost about 4,000 people. We had about over 14,000 infections. It's unbelievable. We're still recovering from that. But one of the things that worked out well for us was the solidarity from the rest of the world that came to join us to fight Ebola in Sierra Leone. And by the second year, our collective effort led us to actually conquer Ebola. So I want to say thank you to the world for all of that help. I want to single out in particular the United States of America because the U.S. sent 1,500 healthcare workers to help us support that effort. So in that same spirit of solidarity, I want to commend our colleagues in Uganda, and thank you, President Museveni, and thank you to my colleague, Minister Ruth Ocheng. We've seen that in these partnerships, solidarity is critically important. What we saw in Guinea in 2021, February 14th, after Guinea declared an Ebola outbreak there, the whole world, all of Africa rallied behind Guinea, and we were able to crush that outbreak in the shortest possible time. So thank you to the world, and thank you to that solidarity. We'll hope that we could conjure that same spirit to work with Uganda to be able to crush this outbreak there, because containing and crushing the outbreak in Uganda saves the rest of the world. Thank you very much, Dr. Root. So in that spirit, I have a couple of questions for my colleagues in the panel today. We were looking at discussing ways of sustainable financing, innovation, and health system strengthening that could mutually reinforce health security and protect against health shocks. My first question is to you, Ambassador Nkengasong. Ambassador, how can diverse disease-specific investments like PEPFAR HIV/AIDS investments be leveraged to support efforts to develop and maintain health security capabilities and capacities and broader health system strengthening, building resilience to health threats and shocks, and promoting economic resilience?
Thank you, Minister Dembi, for your leadership in what you are doing in Sierra Leone. Let me, first of all, start by recognizing our Secretary of Health here, Secretary Becerra. Thank you for those warm remarks. President Museveni, for your long-time leadership in the fight against HIV/AIDS, and President Masisi for your leadership in Botswana in making HIV/AIDS, turning the tides against HIV/AIDS in your country. The topic of this present session is sustainable health cooperation. I think if there's any one area that the United States government has worked very closely with the continent of Africa, I think in my 30 years experience in public health, it is in the area of HIV/AIDS. Over the last close to 20 years, the United States government has made availed more than $100 billion to fight HIV/AIDS on the continent of Africa. The two presidents here, President Museveni, President Masisi, recall very well how devastating HIV/AIDS was 20 years ago on the continent. It was a security threat. It was a serious developmental threat. It was a serious economic threat for the continent. Today, thanks to the investments through PEPFAR, the U.S. President's Emergency Plan for AIDS Relief, the tides have changed together with the Global Fund. I think that is a good example of a concrete example of what collaboration, effective partnership looks like. And in that, about 25 million lives have been saved, 25 million lives. 5.5 million children have been born free of HIV/AIDS thanks to the PEPFAR investments. But very importantly, I'd like to recognize the leadership of the two presidents here. Botswana, when we met at the International AIDS Conference in July, was the first country in Africa that had exceeded the goals to achieve 95, 95, 95. What does that mean? That 95% of people who are infected know their status, 95% are put on treatment, and 95% suppress their viremia. That was the major news at the AIDS conference. We continue to believe that that kind of partnership is extremely important to bring HIV/AIDS to an end by the year 2030, which we should be very careful that we do not leave our eyes off the ball of HIV/AIDS, which is still a serious threat. The UN AIDS reports that were just published on the 1st of December point to the fact that we are beginning to see HIV/AIDS creep back. New cases of HIV/AIDS are coming up. So we really need to continue to work with the presidents who are here and others in Africa to make sure that that trend continues across the board. But the PEPFAR platforms that have been put in place over the last 20 years are a serious health security platform to respond to other diseases. We've seen during this COVID outbreak, the pandemic, how PEPFAR platforms were used to roll out diagnostics, were used to supporting vaccination programs, were used in. Let me just conclude my remarks by saying that on the 1st of December this year, we released a new strategy for PEPFAR, which really focuses on strengthening health systems, but taking a closer look at manufacturing of health-related commodities, especially in Africa. If you look at that strategy carefully, we are saying PEPFAR is ready to work with countries in Africa so that diagnostics can be made on the continent, and PEPFAR is committed to buying made in Africa diagnostics. Secondly, that PEPFAR is committed to working with countries in Africa so that made in Africa antiretroviral treatment can be purchased by PEPFAR and together with Global Fund. So I think I'm very delighted to hear the two presidents elevate that conversation around regional manufacturing. We believe in PEPFAR that in the new strategy that by doing that, It is really a direct way for ensuring regional health security and global health security, because we cannot have global health security without regional health security. Thank you.
Thank you. Thank you very much, Ambassador. My next question is to Chidema. In your experience, what are some best practices to promote, actually, no, this is really intended for a Kenyan colleague, but I'll go back and just say, what are some technologies or other innovative approaches we can invest in today that will strengthen health systems and healthcare delivery during peacetime in a manner that increases resilience to future emergencies, including through improved health security and pandemic prevention, preparedness, and response capabilities?
Thank you, Honorable Minister. Thank you as well to Excellencies, the President and the Secretary of Human and Health Services for having us on the platform today. When I think about innovation, I often sort of describe innovation as the ability to find new ways of doing old things. So when I think about innovation in that context, I guess there are three ideas that come to mind on how we could approach this. And interestingly, there's a common theme from the remarks from the President, from the remarks from Dr. Nkengasong. And for me, the first pillar, the first idea, is centered around accelerating African manufacturing of medical commodities. And on this point, honestly, as a continent, we need to diversify our pharmaceutical supplies. And with manufacturing that is based on the continent, what we will hopefully start seeing is marked reduction in actual prices of medical commodities that's driven by the presence of these manufacturing entities on the continent. This is remarkable for us as a continent because we are also historically plagued by economic concerns. So one of the things that we need to be leveraging is finding new ways of, working on the supply security or the health security situations on the continent without necessarily, taking away from the quality of healthcare on the continent. One other thing that is also related to this accelerating manufacturing capacity on the continent is really operationalizing the regulatory harmonization framework for the continent. We must, as we talk about this acceleration of manufacturing, we must simultaneously be discussing how we can unlock and operationalize regulatory harmonization. Because as we all know today, it's still quite fragmented and it poses a severe risk for that particular pillar. The second idea that often comes to mind when I think about innovation and the current landscape and the ecosystem on the continent is centered around co-creation. Honestly, for me, co-creation is such an enabler of medical innovation. And we must be deliberate about how we approach this. So for me, every time I think about collaboration, I often wonder, why are we not much more involved? Why are we not approaching this why are we not deliberate about approaching this? Because the benefits are immense. We're talking, if we are able to create solutions that are unique to the target population, we can definitely unlock greater benefits and more positive health outcomes for the continent. And honestly, if we start talking about the opportunities of creating these unique products and services for the continent, I honestly think it's going to be mutually beneficial for not just the financing entities like donors, philanthropies, but even for the governments themselves. We've heard today from our excellencies, there is such a huge appetite to strengthen Africa's own system. So co-creation literally means to me spurring, more investment into research and development, more investment into actually creating those infrastructures at a regional and at a local level. And the third idea, the third pillar which is a low-hanging fruit, in my opinion, is really increasing and widening partnerships with regional and local organizations on the continent. I'm sure we are all aware, but recently, or maybe in the last couple of years, we've seen tremendous innovation happening across the continent that's driven by mobile and digital adoption of some technology advancements. And we see this cutting across a wide spectrum of the healthcare supply chain. We see it in how patient education is happening today. We see it in even supply chains and procurement. We also see it in disease management programs. So innovation is happening. There is capacity. What we need to really unlock at a full scale is targeted and deliberate partnerships. And this, I believe, it's going to help. I mean, we need to have deliberate commitments to building this local capacity. Oftentimes, as we work on the continent, I hear people say, oh, we don't usually will give this to you because there is no capacity. Have you looked at what we're doing? Have you looked at what we're doing? There is a lot of work. And just taking a step back and looking at African Medical Supplies platform, we are a digital pool procurement agency that basically we're leveraging our collective purchasing power to negotiate better rates of medical consumables for the continent. So if you look at the kind of work, the scale of the work that we're doing on the continent, it's almost crazy for me when people say there's no capacity on the continent. There is capacity, but do we need to further upskill that capacity? Yes. Do we need to further strengthen what that capacity is able to achieve today? Yes. I mean, if you could even put it in a different way, we need to move away from the legacy systems where, we get partnerships that develop for Africa. What we need to happen today is partnerships where we are working with Africa to develop Africa. Thank you.
Well, thank you very, very much. It looks like we have an ideal panel here where you could actually speak to each other on these issues. It's incredible, Ambassador Kengasong, when you say with all of the investments with PEPFAR, that there's going to be a specific shift now to look at diagnostics and looking at treatment and looking at local manufacturing. And I think what we're hearing from a colleague is, you really want to make sure that the regulatory framework is there and to be able to better manage this process and to ensure also that there is co-creation that's going on that will allow ownership and perhaps looking at the nuances at the local level. So this is incredible. So I was just wondering, based on the kinds of thoughts that you heard from the platform, are there opportunities here for a much stronger partnership between PEPFAR and the U.S. government and the medicines platform that our colleague just talked about?
Yeah, absolutely. I think there's huge opportunities for partnerships and very practical partnerships. During the COVID pandemic, which is still ongoing, one of the most important innovations in terms of the continent of Africa responding to the threat was innovation made out of the Afri-Exim Bank, which is the African Export-Import Bank in Cairo, where they made two important innovations and exercised greater leadership. One was the support in establishing the African Medicine Supply Platform, which if you Google, you pull out your phones and Google AMSP, you will show up like Amazon.com, and you can actually go in there and shop for products there. Second was enabling the vaccine acquisition. His Excellency President Masisi talked about the AVAT platform, the African Vaccine Task Team. And that was achieved because the Afri-Exim Bank enabled $2 billion for the continent to purchase vaccines, the 400 million doses of vaccines. So why is this relevant in this partnership? As we discuss the pandemic fund, I think those are instruments and opportunities for partnerships that can be leveraged. So we learn lessons on how the continent, the Afro-Exim Bank and others, and Chirima did it, and then build partnerships. Partnerships that will not be a partnership of the United States donating to Africa, but strengthening and truly cooperating and enhancing those instruments and architectural systems that were put in place during the COVID response. That is my hope, and wish that a lasting partnership is a partnership that the continent has a stake in it, and they already demonstrated that.
Well, Marcel, that's just brilliant. So, Chilima, you have any reaction to that? Because clearly you're speaking to each other. It looks like there's such complementarity and a feeling that the Africa of today and of the future is a forward-looking Africa that's looking at innovations that are built from within and for us. And the partnerships that you're looking at is real mutually beneficial partnerships rather than a donor-recipient relationship. So what's your reaction to Ambassador?
Honestly, just to kick off, Ambassador Kengasong is the founding partner for AMSP as well. AMSP was really conceived by the Africa CDC as well. They are the ones that had put together the initial structure. They had been the ones also to put together the initial product assortment for the platform. So, I mean, we are excited about, this particular opportunities, but I suppose my message today is earlier than later, right? Because what we often hear, and this is not directed at any program in particular, but what we often hear is, we can do this with you, but you need to do X, Y, Z, or you need to arrive at this level of maturity. And my question often is, how do we arrive at that level of maturity if we don't get the support? To be able to arrive at that, we honestly need your support to grow this program. What we've been able to build has been a remarkable proof of concept that Africa in itself can develop programs like this and execute on these programs. What will be really crucial as we scale and build sustainably is to get this, pockets of support that will allow us to strengthen not just, the structure itself, the processes, the people, to position ourselves for even more impact, if you will. So I'm really excited with Ambassador Kengasong's confirmation about the opportunities that currently lie with the partnership with entities like the AMSP. But my message is the sooner the better. The sooner the better. Let's leverage the current gains.
Well, thank you very much. I think our presidents will be very pleased that they have a continent in very strong hands, and we're looking forward to mutual collaboration built on mutual trust. And I think what you're seeing here is, when given an opportunity, Africa can and will stand up and be able to solve the problems that we confront. What we're looking for is just genuine partnership. What we're looking for is collaboration, and what we're looking for is an opportunity to be able to let what we're thinking of really be the best for our continent. So I think we couldn't have had a better panel than what we have today. Speed is of the essence in all of this. We don't know when the next outbreak is going to be, and we know that if something happens and you respond quickly, you're able to contain it. If you slow the process, it becomes more expensive, it becomes more difficult. And quite frankly, the best time to prepare for an outbreak is during the quiet time. So now is the time for us to get this done. And I really want to thank my president, President Bio in Sierra Leone. The lessons we learned from Ebola, the lessons we learned from these other outbreaks were effectively important in us getting the speedy response that you saw in Sierra Leone that allowed us to contain the outbreak, 4 waves of the outbreak, allowed us to have the least number of fatalities, the least number of hospitalizations, because of this partnership, because of this collaboration, because of the strength and trust in the local people to look at local solutions. So thank you very much. thanks to you all for helping us walk through this panel.
Thank you.
Thank you.
Thank you very much. Thank you.
Well, thank you very much. To our panelists, thank you, sir. Honorable Minister Denby closed this out quite well. I definitely enjoyed the conversation that he held with Ambassador Nkengasong and Managing Director Efepe. Before we get into our next panel, I'd like to introduce a special guest that the Secretary acknowledged earlier. We are joined by Congressman Stephen Horsford, who is from the great state of Nevada. And Congressman Horsford has been doing quite a bit in his role in Congress, including working to crush the coronavirus, as is said here, and as we mentioned earlier, but also restoring public faith in government institutions, not just health institutions, but other institutions, in addition to focusing on recovery, which has also been mentioned as part of our conversation today. Just a couple of more details about the congressman before he comes up. He has worked to really focus on veterans and seniors in the work that he does, and also has fought to protect a woman's right to make her own healthcare decisions, which we certainly appreciate here at home. Born and raised in Las Vegas to an immigrant mother, he brings a principled focus to Congress on job creation, community development, and skills development. And so with that, we welcome the congressman to make a few remarks before our next panel. Thank you, sir.
Good afternoon. Thank you very much. It's an honor to be here, Mr. Secretary. Thank you for the opportunity, and it's an honor to join with heads of state from our friends on the African continent, together with the best and brightest in the United States to discuss strategies for our mutual and global success. As we learned with the COVID-19 pandemic, and as we have seen with many health threats throughout the ages, from polio to HIV, a robust health workforce is vital to protecting lives in all of our nations. As the incoming chair of the Congressional Black Caucus during the 118th Congress, which will start in January, I bring you greetings from the 58 members of the Congressional Black Caucus, referred to as the conscience of the Congress. We represent more than 80 million people throughout the United States, 17 black million Americans. And we are committed to working with our partners around the globe and ensuring that the African continent sees the same kind of collaboration, partnership, and support that we have with so many other nations. In terms of protecting our health systems and infrastructure, we must have the trained personnel from doctors to nurses to researchers and other practitioners. And the people, your citizens, must have access. And that sometimes means bringing the healthcare services to their communities, especially those in remote and hard-to-reach areas. Here in the United States, we see that health insurance impacts the ability and willingness to seek care until it's too late. So we must create a healthcare environment that encourages regular health checkups and preventative care. Creating that kind of proactive healthcare environment will not only save lives, but it will also save money on treating more serious conditions that could have been prevented to begin with. Addressing this together, we can fight disease and close disparities around the world. And if we haven't learned anything else from COVID, we are only as healthy and safe as the most vulnerable people. So our healthcare strategies must help everyone if they are to be effective. Providing the care the most vulnerable people need will help reduce risk for all of us. And our battle against HIV globally continues. I want to commend President Biden, Secretary Becerra, and this administration, who who have committed to ending HIV and AIDS here in the United States and around the world. We have excellent treatments that are available now, and we need to ensure everyone who needs it has the access. And preventative treatments like PrEP medications must be made available to more people to stop the spread of the HIV virus. That is why sexual and reproductive health care for young people is also important. Giving people the facts about these issues will protect our communities and save lives. So again, thank you for being here today, for having me for this summit, which is incredibly important and an important moment in our time, in our history. And I look forward to hearing about the productive conversations that are had here on this panel today and throughout this summit. And I want you to know that on behalf of the Congressional Black Caucus, we look forward to your continued partnership. Our doors are always open, and we look forward to our mutual success together. Thank you.
Okay, well, thank you again, Mr. Congressman. And panel 2, don't be shy, come on up. I will be introducing our next moderator, Ms. Nardos Bekele-Thomas, the CEO of the African Union Development Agency, or NAPAD, and she has been holding that position since May of this year. Formerly, she was head and resident coordinator of the UN in South Africa. And before then, she held a number of senior roles with the United Nations, including in the Office of the Secretary General and with UNDP in Kenya. Not to be left off her bio, she also has served as a private sector policy advisor, which is incredibly important, as we heard from our speakers earlier. She's focused on the development and management of micro, small, and medium-scale enterprises, and in addition, has a strong belief in promoting women and youth. And so I want to acknowledge her and her work in partnership, both inside and outside of governments, with various sectors and organizations in the region and in the U.S., and thank her for joining us as our moderator.
Thank you very much, and good afternoon, everybody. You know, I think we know we're rushed with time, but we'll be short, brief, and sweet, to the point, yeah? Well, we all know that, you know, COVID-19 was really disruptive. But in the meantime, for Africa, in my opinion, it has also been an awakening call, because, you know, for all what we have done, it's incredible the achievements that we have registered in a short period of time. COVID-19 response fund was put in place immediately to support pool production of diagnostics and other medical commodities by African CDC. African CDC was strengthened. African medical regulatory harmonization was established. You know, the establishment of African Medicine Agency in September 21 is a landmark, and also the support to the manufacturing of vaccines. And we have got 4 countries that have really started manufacturing vaccines. And the Partnership for Africa Vaccine Manufacturing was really put in place. All these things happened in the last 2 years. And, you know, we sometimes look at things, you know, the glass half empty, but really for us, I see it as half full. You know, is it all done? No. The strengthening of the health systems and the ecosystems need to be looked at. You know, we need to really foster and really have a very effective partnership. We need to have investment in our health systems and certainly in our health insurance and the entire health ecosystems. Well, I have got these 3 eminent people, and this is about you, not me, so I'll stop here. So, you know, we have got, you know, these 3 eminent people, speakers in the panel. We have, oh my goodness, yeah, first I will start with Minister, Honorable Kumbezi Kandodo Chiponda, who is the Malawi Minister of Health. And I have a question for you, Minister. Honorable Chiponda, Malawi has made huge advancement in improving health in the last decade, cutting in half the under 5 mortality, the mortality rate. And, congratulations for this achievement. In your opinion, what role has Malawi's investment in the health workforce played in such impressive gains? You have got like 4 minutes, I think. Yeah.
No, thank you so much for the question, and thank you so much, the organizers, for the opportunity just to interact with the audience. We don't take it for granted. Indeed, as a country, Malawi, we have come from far. We are not yet there, but at least something is being done, something right. In terms of infant mortality, indeed, we have moved from 52.4% to 29% per 1,000 live births. In terms of neonatal, 27.9 to 19.1. Like I said, it just shows that maybe we are on the right directions. I think we have been able to achieve this mainly because of change in policy direction. Now we have a community health strategy which we are following, but also we have a health sector strategic plan. The first one was from 2017. It finished this year. We have reviewed it. We will have another one which is going to run from 2022 to 2027. But also other things which have improved, it was in terms of neonatal care. We have had to recruit more midwives. We have had to train more community midwife assistants as well, considering that 70% of our people, they're in the villages. So we need somebody on the ground to be there. But also, with the help of our partners, those who have spoken before me, including our presidents, they've already talked about, the prevention of transmission of HIV. It meant a lot to us. Most of our children, they were saved. Prevention of the mother to child. That meant a lot. All the interventions in fighting malaria is still #1 killer. The interventions which we're employing, thanks to Global Fund, we're able to distribute 9 million nets. Each and every pregnant woman in Malawi, when they go for antenatal, they get a mosquito net as the part of the intervention. So these interventions, with the help of our partners, they're really, yielding the results which we are talking about today. Also, immunization. It is mandatory that all the children in Malawi, they get immunized with all the different types of immunizations which we have in Malawi. So with the help of our partners, we are able to do this, and that is why, we can see improved indicators when it comes to neonatal, when it comes to under 5. However, I don't want to dwell on the gains. I want to dwell on the challenges which remains there. Because to me, what really bothers me is that I have this baby. We have invested so much in terms of preventing the mother-to-child transmission. I have this baby, which all of us invested so much in terms of immunization. I have this baby. We have fought so hard to give the mosquito net, and then only to have that child succumb to pediatric cancer. Because I don't have diagnostic centers in Malawi, because I don't have a trained nurse, a specialist nurse in Malawi, because I don't have a national cancer center. In terms of cancer center, now we are constructing one. We are yet to put the backers, but now I have to talk of specialist services being available. So that is why I was very, very, happy with the topic partnering for sustainable health. Because sustainable health, it means we have this child who we have done a lot to make sure that this child from 1 to 5, she is okay or he is okay. How do we see this child through adolescence? How do we make sure that they don't get pregnant when they're young? How do we make sure that she stays or he stays in school and becomes an adult? How do we make sure that when they have some other issues of mental health, I have the specialist services to offer this child because of different reasons. All of us now are struggling with mental health, and yet we see less investors interested in mental health. So to me, what would really make a difference is to have partners coming into Malawi. What is it that we do? Do we partner with the government or private sector to provide diagnostic centers which we can, test our children, to provide, social cycle services to our adolescents, our youth? That kind of support is that we need. So I think my
Thank you
time's
so
up. Let
much.
me stop there. Thank you.
Thank you very much, Honorable Chiponda. Certainly, the promises of Malawi, regarding universal health care, has been fulfilled. It was accompanied by action, by planning and budgeting, but more needs to be done in terms of building the ecosystem. To you, Dr. Gwande, given your unique vantage points, leading USAID's global health portfolio, I'm just curious to hear your perspectives on the US government's partnerships with governments of Africa in support of the health workforce.
Thank you for,
More specifically, how is the United States working with the countries in the region to support the African health workforce?
excellent. Thank you for that opening, and thank you to Minister Chiponda of Malawi. This is such a great example. In the last 20 years, Malawi has raised the life expectancy of a human being from 47 years to 65 years. In the space of 20 years, raising the life expectancy by 18 years. I mean, that is just incredible.
Yeah.
And it is still a state of affairs where it is unacceptable to have a 65-year life expectancy in a world where, with adequate public health and appropriate health access to health services, you can live 80+ years life expectancy. And that is the measure still of the equity gap. Now, the gap here is measured in the health workforce. A quarter of the global disease burden in the world is in Africa, where there is only 4% of the global health workforce. You cannot close that gap without addressing and meeting the needs of that global health workforce. The region, the African region, requires, in order to meet the SDG goals for health, like the levels of basic achievement in child and maternal mortality, the gap is 5.3 million health workers, and that's nurses and doctors, that's community health workers, it's epidemiologists and laboratorians. It's the basic system of care that's lacking there. I want to be substantive about what we want to do as a U.S. government. We have completely backed the idea that that enabling that workforce is foundational to our efforts of what we've done, and across the U.S. government, not just USAID, but also including the President's Malaria Initiative and PEPFAR. We spend about $1.3 billion annually on supporting and enabling the health workforce, either directly, salary support, but also through training, technical assistance, and upskilling so that people are able to function in better and better ways to support health needs. In May this year, because we've seen not just that we have this gap to go, but we've also seen substantial losses under COVID because of the damage to already fragile health systems from COVID. The President Biden and Vice President Harris announced a global health worker initiative to put investments into further strengthening and protecting that health workforce that is so critical. As part of that, we are also aiming to sustain and improve our investments by working with Congress to program at least $4 billion of investment in health workers as part of our global health efforts by fiscal year 2025, and with better coordination with regional and country health workforce priorities across the USG. For example, your discussion of wanting to better support community health workers. We know that what it takes to be able to achieve this work. First of all, it's tighter alignment than we've had with our partners, our regional partners, including Africa CDC, the African Union, and WHO AFRO. And we are committed to doing that, and we have worked with them closely to also achieve a particular emphasis in what Director General of the WHO, Dr. Tedros, called a radical reorientation of health systems towards primary health care. This is crucial. Why? Because the evidence indicates that a health system anchored by a strengthened primary health care system delivers the results we need for lower mortality, improved equity, and gender inclusivity, and also increased cost efficiency. So as part of our work, we are therefore joining with the goals of African Union and Africa CDC and WHO AFRO to support that community health workforce and the upstream investments in primary health care clinics. And USAID is announcing today, as part of that, our commitment to accelerate primary care by coordinating our vertical global health investments across all of our work in 5 focus countries in Africa. Those 5 focus countries where we're starting, and this is to coordinate across all of our USAID global health investments. Thank you to David Walton, who's here from the President's Malaria Initiative, also with PMI, in Cote d'Ivoire, Ghana, Kenya, Nigeria, and in Malawi. In addition, we have the support of John Nkengasong and PEPFAR to include PEPFAR investments in Malawi as our anchor place to prove that we can all work together in collaboration to create a better foundation of a primary healthcare system. And just last month, I also got to announce that we're coordinating these investments with the Global Finance Facility so that we're all working towards one primary healthcare aim. And so with that, I hope we will be showing they'll be delivering concrete, visible progress in the months ahead for the Africa region, starting with these 5 countries and then expanding from there.
Yeah, thank you very much. Thank you so much. Thank you very much. So, I'll go to Dr. Ayoade. Dr. Ayoade and Dr. Alakija. Yeah.
Just call her Yodi.
Yeah. Oh, that's it. Yeah.
Yodi. Yeah.
Okay. Why is promoting a robust health workforce so important for Africa? What types of partnerships are needed to support a sustainable and robust workforce across Africa?
Thank you very much. And also I want to add my congratulations to the Secretary of Human Health Services and to the team for putting this together, and also to the US government for having us all here this week. I think really my colleagues have said it all. I mean, the imperative is clear. We need to improve, and we need to go beyond what Atul just said. Only 4% of the global health workforce are in Africa. But I think also we have to recognize that not only do we not have enough people trained, we're also, those that we're training, we're leaving. We're losing. So we need to look at retention. How do we retain the health workforce that we have, as well as upscaling our training? How are those investments that you're making in training people not going to mean that those people, because of course we have to balance retention with free movement of people according to the WTO imperative, so those people are also free to leave. I'll give you an example. The University College Hospital of Ibadan, which is where I trained as a medical doctor in Nigeria, about a month ago, the chief medical director raised an alarm and said that he has lost 661 doctors and nurses this year alone. That is one hospital. So the retention, I think, and the investments have to be in ensuring that the health workers that we are training, and it's wonderful to have investments, and really welcome the announcement today of the $4 billion by 2025 for care workers across Africa. Welcome the 5 focus countries, and thank you for that work. But we also have to begin to look at, thinking strategically about how we sustain those partnerships and make them true partnerships, how it doesn't become the sort of, well, we're going to give you money to train healthcare workers, or we're going to send you healthcare workers. You know, my seminal work, my first job ever was in the Pacific Islands. I was regional health coordinator for the region, Pacific region, and what we did there was develop a cadre, a health workforce, and my job was to produce that curricula to train Pacific Islanders for the Pacific, not train them to export to Australia or to New Zealand, which is the immediate export market, but to train them for the Pacific, to train them with specific skills that were local and that ensured that their skills were I mean, not that their skills were not transferable, but their skills were it was local solutions for a local problem. And you know, look, right now, it's very clear that with the geopolitical shifting sands, Africa has become a much sought after strategic partner, not just in the health space. You know, we've heard brilliantly from Chidinma earlier today about what's being done with the medicine supplies platform. As she said, proof of concept, but it shows that we can do this. And as the second largest continent in the world, it is indeed time that our voice and the voice of our leaders and our health leaders are also heard on the world stage. So whilst we welcome the efforts and the conversations around partnership, we must speak now about the practicalities of those partnerships. Yes, we recognize that most of the health workers are women as well. 70% of their health workforce, bless you, are women on the continent. What are we doing to protect those women's rights? What are we doing to protect their ability to work? What are we doing from a gender perspective? So we need to move beyond the siloed approach of a health workforce, or you know, we're training, you know, people for TB or malaria, but we need to think more across the board. How do we look at the holistic definition of health? How do we train women and girls across the board? How do we put that investment of 12 years in a girl's education to make, because that is the greatest investment of all. That will mean that, number one, that girl can enter that health workforce, but it will also mean that our investments in preventing disease, that sense of wellness, is therefore protected, because of course, you know, on this panel, you are totally outnumbered, my friend. You know, you train. So this
70%.
Yeah, this is a girl power panel, and I'm sad that our presidents have left, because part of my challenge is also to the leaders of Africa. So those of you who remain here, who are ministers, and I'm delighted that my sister Jane and my sister Dr. Chiponda, that we have ministers here who are women, that we need to champion women on the continent. So for you, my Iyawo, Nados, for you with your role at the Africa Union as well, the very basics of our health, the very basics of our training of our women and girls, and investments in their wellness and investments in their education is really where we're going with our investments in health workforce. So I think let's go back to the basics, and let's look at the partnerships across the board that help us to deal very, very, very practically with those basics. Partnerships that are not paternalistic, that are not patriarchal, but partnerships that are respectful, partnerships that have us looking each other in the eye and not having somebody looking down on us. We've heard a lot about that today. So this is a short time to make that argument, but we're very grateful to the US for this. And my final pitch is that, you know, the US-Africa Summit is wonderful, but perhaps, and also for you as AU, perhaps, and President Orama here of Afrexim, maybe let's throw this in your basket as well, that at the edges of the next AU summit, maybe in a year's time, let us invite the leaders of the world as well to come into our backyard, and let us have 2 days of extra sessions where we welcome the world so that they can meet us at home.
Thank you very much. Thank you so much. Please give them a round of applause. Yeah, truly, you know, in order to build our workforce, first of all, we have to really create that conducive environment to retain our doctors. Our doctors, many of them are abroad than in our own countries. So we have to interrogate ourselves and ask a question, why are they leaving us?
That's right.
Okay. The second thing is build the capacity. First of all, when we do planning, do we really talk to our medical schools how many doctors we need and how to train them, what the skills are required to deliver the plan that we are putting? Because projection tells us what the population would be in the years to come and how many doctors we would have, what infrastructure we need, what kind of system we need in terms of health sector. So planning is very important, but you have to plan it with the institutions, research, and also learning institutions. It's very critical and very important. And also budgeting, investing in people is the most important thing. Investing in human capital is critical and very important. And we always look, outwards for support, but that is where our money should be. And I would really like to thank you, especially you also, for making sure that the promises are followed by action in your government, in the primary health care, and for showing results. And that is caring. It's very critical and very important. And finally, I would like to say thank you to the government of US for this occasion, and we would like, as African Union, to work with this, of course, America. We have John here, who is really, a member of the AUDA, and I'm so grateful to him. Afrexim Bank is our partner, and all the business sectors. But let's also promote private sector to invest in healthcare. To invest in healthcare. There is no need for Africa to go elsewhere. We can build, all what it takes to make sure that our population live in a healthy environment. Health is security. Health is a human rights. I thank you. Thank you very much. Thank you so much.
Thank you.
Thank you, Madam Bekele Thomas, Minister Chiponda. Very nice seeing you again, Dr. Kuwande, and also, of course, Dr. Alakija. Really great and energetic panel, which is hard to do at the end of a session. I have the pleasure now of introducing everyone to some of our closing speakers. First, I know that we have talked a lot about the Africa CDC, and I know that they are in the midst of their own convening in Rwanda this week, but we do have a special message from their acting director, Dr. Ahmed Ouma. With that, I would like for us to tune in for his remarks on the screen. Thank you.
Your Excellencies, our heads of states from Africa, our co-host, Secretary Becerra, all ministers, heads of institutions that are present here today, I send you very warm greetings from Africa. At Africa CDC, we take our mandate of safeguarding Africa's health very seriously. The lessons that we've learned during this pandemic are very clear for us that we must and we need to work with partners to be able to do even more for the continent of Africa. Health security globally is not complete until every part of this world is safe from outbreaks and disease threats. Africa is willing, able, and ready to do its part. We are asking you, as our partners, to join us in implementing the new public health order so that we can be able to do things differently, to be able to achieve different and better results. A core part of the new public health order is partnerships. Sustainable partnerships that are respectful of Africa's priorities, sustainable partnerships that are action-oriented and are going to deliver even more better and bolder results for the continent. As we leave the acute phase of the COVID-19 pandemic, let us carry the lessons that we have learned and let us implement those actions that are going to ensure that we never have to repeat these lessons again. Africa CDC is ready to work with all our partners so that we can be able to secure the continent from disease threats and outbreaks, and that is the only way that the health security architecture for the world is going to be even more secure than it is today. Africa is part of the solution, and we are inviting you as our partners to work with us so that we can be able to achieve those that have been eluding us over the past many decades. We are safer together. I thank you.
We're certainly grateful for those remarks from Dr. Uma, and of course are grateful for our ongoing and enduring partnership with the Africa CDC. On that note, I'd like to introduce another special guest to close us out, Dr. Rochelle Walensky, who is, of course, the director of our Centers for Disease Control and Prevention, as well as the administrator of the Agency for Toxic Substances and Disease Registry. Dr. Walensky has done quite a lot in the world of public health, including in the fight against HIV/AIDS. And I don't know if many people are aware of her storied career in that space, but we are grateful for her service both domestically and internationally in that regard. In addition, just before coming on board as our CDC director, she served as the chief of Division of Infectious Diseases at Massachusetts General Hospital, and was a professor of medicine at the Harvard Medical School until 2020. Of course, she has a number of degrees, including a Doctor of Medicine from Johns Hopkins School of Medicine and a Master of Public Health from Harvard School of Public Health, and we're just grateful for her being with us today. Dr. Walensky.
Thank you, Assistant Secretary Pace. It's truly an honor to be with all of you today and to really close out my today's important summit with my thoughts. Let me also thank President Biden for hosting this summit, Secretary Becerra, His Excellency President Museveni, and His Excellency President Masisi for opening this health session, and all the distinguished leaders, ministers, and partners for traveling to DC to be part of this critical summit. And I extend my thanks to my colleague, Dr. Uma, for his video message, particularly given his need also to focus on the second International Conference on Public Health in Africa, which is actually occurring simultaneously in Kigali right now. Today, we've talked about the importance of our partnerships and what we can do together to address Africa's health security threats and workforce needs, and how we can continue to build resilient systems that will serve Africa for years to come, building on the public health investments and the long-standing and extensive collaborations we have developed over the decades on the African continent. Indeed, CDC has over 1,300 staff in 33 country offices in Africa, working closely with ministries of health, local partners, the WHO, and others with the shared goals of improving health and health security for all. Our approach prioritizes host country ownership, investment in local partnerships, development of sustainable capabilities, sharing of technical expertise, and building and promoting a robust public health workforce. So today, I'm happy to announce several new and expanded initiatives. Public health experts all over the world recognize the need to establish pathogen genomics surveillance capacity. While there is ample support to purchase equipment and develop online trainings and in-person workshops, as you've just heard, support for bioinformatics is actually the biggest challenge. Educational programs in Africa are just beginning to be developed in this field, and since the field is so new, there are few people actually to provide that mentorship. Therefore, CDC in the US is working with Africa CDC to place an expert in public health bioinformatics on the continent to provide support and mentorship. Filling this position will have immeasurable impact and be a valuable and sustainable tool for health diplomacy in this emerging field. The Field Epidemiology Training Program, FETP, is recognized worldwide as an effective means to strengthen capacity to prevent, detect, and respond to public health threats through enhanced surveillance, epidemiology, and outbreak response functions. CDC has helped train more than 10,000 disease detectives in 34 sub-Saharan African countries through FETP, and for the coming year, there are expansion activities planned in Mauritania, Ethiopia, and Nigeria. This is very exciting. About 80% of FETP graduates remain in their country's public health sector following completion of the program, and many are also leaders and managers in their own organizations. So building this workforce truly strengthens our capacity to address emerging and endemic health threats. Starting in February 2023, CDC will pilot an FETP frontline curriculum in Cameroon and Kenya, incorporating One Health principles. These pilots will expand the ability of FETP graduates to conduct multi-sector outbreak investigations that explore the important intersection between humans and animals and the environment. In recent years, FETP has also expanded in some countries to include a focus on non-communicable diseases, or NCDs, and associated risk factors. For example, in 2019, the Ethiopia Field Epidemiology and Laboratory Training Program in the Ethiopia Public Health Institute established a training program focusing on cardiovascular disease risk factors. The program works with the Ministry of Health, universities, and Resolve to Save Lives to support and mentor advanced level trainees. They're also currently recruiting the 4th NCD cohort, increasing their capacity to address non-communicable diseases and build a workforce trained in communicable and non-communicable disease field epidemiology. Through CDC's collaboration with many global partners, the Global Laboratory Leadership Program, or GLLP, fosters and mentors laboratory leaders of today and for the future to build and to strengthen and to sustain national laboratory systems around a One Health focus. This aligns with a long-term goal and priority of Africa's CDC's Biosafety and Biosecurity Initiative to provide training to strengthen national laboratories and institutes. The program has grown from one African country, Liberia, in 2017 to 16 African countries in planning or implementation stages in 2022. And planning is underway to implement the program in several East African countries in 2023. Burkina Faso is one of the first countries to take steps to incorporate the program into existing continuous education programs. By working with local medical and agricultural universities in 2022, CDC began the process to integrate the program into the Joseph Kierbo University diploma in Ouagadougou. The key objective of the GLLP is developing a sustainable program owned by the country that can be adapted and integrated into the university's curriculum. CDC is actively working both locally and within each country region to reduce the personal safety risk from infectious diseases threats facing healthcare personnel across Africa through a number of initiatives and programs, working closely and collaboratively with implementing partners. These efforts involve healthcare worker surveillance to quickly detect COVID-19 and COVID-19 breakthrough infections, facility-based comprehensive safety assessments and quality improvement initiatives to ensure continuity of essential health functions, infectious disease threat rapid detection and response networks, healthcare worker training, supportive supervision, and regional communities of practice, and technical expertise engagement with ministries of health to ensure implementation consistent with global norms and sustainability. In the next year, CDC is excited to expand healthcare personnel safety training to new cohorts and to pilot new sites in Sierra Leone, Nigeria, Uganda, and the Democratic Republic of the Congo. As most of you are aware, earlier this year, the U.S. government and the African Union signed a renewed memorandum of cooperation outlining goals and objectives for our partnership with Africa CDC, expanding upon previous agreements. This demonstrates our continued commitment to exchanging best practices, supporting global health security capacity building, expanding and strengthening the health workforce, and supporting health commodity manufacturing capacity across Africa, always keeping in mind locally identified needs. So much strategic, thoughtful, and hard work went into that renewed memorandum of cooperation, and I thank all who are involved. We are looking forward to working with partners at Africa CDC and our country partners in implementing the Memorandum of Cooperation through the Joint Action Plan, which we are working to finalize in the coming weeks. When I mentioned earlier that CDC has 1,300 staff in 33 countries across Africa, what I didn't say is that more than 1,000 of them are locally employed staff, citizens of the country or sometimes third country nationals. Our locally employed staff provide critical, scientific, programmatic, and administrative leadership and support across a variety of roles. They are truly the backbone of our global workforce, especially because they have the long-term relationships with ministries of health and country governments, deep historical knowledge and institutional memory, and serve as critical bridges to local partners. Our locally employed staff often rise to the challenge of complex environments and have ensured continuity of country office operations through many years and often even decades, including and especially during times of crisis. Across the continent, they are engaged in innovative work, and their dedication and commitment has been integral to the success of our country offices in Africa and beyond. Our global successes truly belong to our health workforce, including our locally employed staff colleagues. Our commitment and support to maintaining and elevating the health workforce has been, is, and will continue to be a top priority. Thank you again for the opportunity and the privilege to join you all today.
Okay, ladies and gentlemen, we have reached the end of this epic and informative session. I will just take the time now to thank everyone for joining us, for being so engaged, for being so enthusiastic, in fact, about everything that was discussed, from the various calls to action on workforce and innovation to the broad commitments to partnership and trust. I have the pleasure now of introducing our final speaker. She is joining us by video and a pre-recorded message, but we wanted to make sure and give her a voice for our in-person and online audience today. Of course, that's Her Excellency, former President Ellen Johnson Sirleaf of the Republic of Liberia. And I think she probably needs no introduction, but we all know how committed she is to freedom, peace, justice, women's empowerment, and democracy. Of course, during her terms as president, she did quite a bit, not only in the space of health, but beyond, and continues to be a leader, particularly around global health security in recent years. And so again, I thank all of you who joined us online. I thank all of you who joined us in person. And with that, would like to introduce Her Excellency, Madam Johnson Sirleaf. Thank you again, everyone.
Excellencies, we come together following a hard period of setbacks, but also great optimism about what can be achieved on the African continent. I speak to you today as a former president with lived experience and lessons from managing the West Africa Ebola outbreak of 2014-2016, and as former co-chair of the Independent Panel for Pandemic Preparedness and Response. The Independent Panel made a series of recommendations to transform the global system to stop outbreaks from becoming pandemics of such devastation as COVID-19. First, I'd like to speak about lessons from Ebola. Ebola taught us that bringing a deadly virus under control is a matter for all of government and all of society. When Liberia was struck, I brought together the cabinet. We worked across ministries. And vitally, we worked with communities, with business and religious leaders, with community leaders and leaders of political subdivisions of counties and districts. I even wrote a letter to the world. Leadership happened at every level. Partnerships were also key, including, of course, with the United States, the World Health Organization, Médecins Sans Frontières, and many others. Together, we beat Ebola. A lesson was the importance of investment in strong health systems. This includes investment in people primary care, doctors, nurses, researchers, and laboratory technicians. I believe professional community health workers, properly trained, equipped, supervised, and paid, are best prepared to provide essential health services in their communities. The people health systems are meant to serve. Another lesson was regional solidarity and the importance of cross-border cooperation. We took those lessons to the COVID-19 fight. I remember the African continent was the first to join forces. On February 22, 2020, health ministers of the African Union came together in an emergency meeting and resolved to work together to share information and coordinate control measures. The Africa CDC, just 3 years into its mandate, worked quickly to support countries faced with a new virus of which we knew very little. The COVID-19 pandemic exposed African countries to substantial health, economic, and social harm. No continent was spared. Even the wealthiest countries in the global north, deemed the most prepared, suffered gravely. But the pandemic also showed clearly that more than ever, the African continent must and can be more self-sufficient. The inequitable response to COVID-19 put us last in the queue for vaccines, treatments, and diagnosis tests. The pandemic exposed inequities in access to critical medical products like vaccines and tests, in access to capacity building, in access to healthcare systems, and exposed our communities to misinformation. To begin to address inequities, the Independent Panel for Pandemic and Preparedness and Response recommended a new system to research, trial, manufacture, and distribute tools like vaccines, treatments, and tests. They should be made much closer to the place that require them in Africa and the world. Africa's plan to manufacture and produce the up to 60% of vaccines intended for the continent by 2040 will need support from the United States and other countries to reach these targets. This means technology, innovation, investing in African researchers, African laboratories, African manufacturing and distribution, and also in community mobilization, health information, and demand. We need to be ready to respond rapidly to outbreaks at their source, including with products that suit the reality of African countries' climate and geography. The independent panel also recommended a sustained fund for pandemic preparedness and response be established. A pandemic fund now exists and will soon be put out a first call for proposals. The United States has shown great leadership to help make this happen. Rwanda's Minister of Health is a co-chair of the fund. The African Development Bank is an implementing entity, but we need this fund to grow. It now has about 1/10 of the 10.5 billion US needed annually. The panel recommended a financing model whereby all countries pay what they can, and the countries requiring the most support can rely on getting it. I encourage our African countries to be involved in this fund, to advocate for the funds required, to make proposals for funding, and to invest nationally in pandemic preparedness and response. On health workforce, Dr. Ahmed of the Africa CDC shared the vision of Africa's new public health order. The new public health order prescribes the leadership and commitment we need to meet the health workforce needs, including doctors, nurses, midwives, and the 2 million community health workers that the AU has set as a target. I see momentum already. In support of this strategy, earlier this year, I launched the Africa Frontline First Initiative and a catalytic fund hosted by the Global Fund, which has mobilized nearly $100 million to strengthen the community health workforce in Africa. In Geneva, there are processes underway to amend the international health regulations and to negotiate a new pandemic accord. Here are opportunities to address issues of equity, financing, and health systems to encourage the African states to fulsomely take part in these processes, which will define the way the world prepares for response to pandemic threats. Finally, at the United Nations General Assembly in New York, there will be a high-level meeting for pandemic prevention, preparedness, and response no later than the end of September 2023. South Africa's leadership was central to making this happen. The independent panel has recommended that to truly transform the international system for pandemic preparedness and response, we require a Global Health Threats Council to bring the system together. This will be comprised of heads of state, inclusive and representative of all countries. The political declaration that will result from the high-level meeting is an opportunity to call for such a threats council. I stress again, and all of us here learned in this pandemic, that pandemic threats must be tackled as whole of government and whole of society issues. It requires accountability and action from the highest levels of political leadership. The Ebola outbreak could not have ended without presidential leadership. I urge you to take this same approach to pandemic threats and harness what we have learned from the COVID-19 pandemic to ensure the continent has the resilient health workforce and health systems that it needs to continue responding to this pandemic while also preparing for the next. The future of our African continent and of the entire world is in your hands. Let us safeguard our health and secure a brighter future. Thank you.
brings us to the end of our program. We would love to thank all of our panelists, our heads of state, and everyone who attended today. Thank you, and enjoy the rest of the summit. Have a good one.